Hello, everyone. This is another Freedom to Feel conversation. And my guest today, again, is Dr. Christine Silverstein.
Mhm.
She's a peak performance coach, founder of Summit Center for Ideal Performance. She's also a
Mhm.
behavioral health registered nurse and clinical hypnosis expert. Dr. Christine is also a researcher, historian, and bestseller author. Her book's titled Wrestling Through Adversity: Empowering Children, Teens, and Young Adults to Win in Life. So, this is a brief introduction again for Christine. The full bio will be at the end of this video. So, I guess to before even I mentioned what the topic is, which is the second
Mhm.
chapter of your book titled Cracks
Mhm.
in the Institutional Wall, I
Mhm.
want to, as an introduction for those who don't know you yet, Christine, why do you do what you do these days? Why do you engage in this meaningful, beautiful work?
Well, as a peak performance coach for many years, nearly 28 years now, I specialized in working with children, teens, and young adults. Most of my clients are in those age groups. And so I learned early on that you can work with them to help them use the power of their minds. And since I am a clinical hypnosis expert, and that you can start very early with children to set them up, because I have worked with 7-year-olds to help them win wrestling championships and
Yeah.
all the way up, through young adulthood. And I know there's something that we can do as parents because we have that ability to connect with our children and the willingness, but sometimes we don't know how to approach it.
Right.
And that's what's happening now with mental health. And we cannot depend on the government or other people to
Mm,
help us. We have to learn the
mm,
basic way to communicate with our children. And I believe it starts from infancy, and that we shouldn't wait until they're teenagers, but we should start to incorporate ways of communicating that uses the power of the mind. And we teach them mathematics, and we teach them, history and things like that. Well, why not how to use the
mm,
power of your own mind that's
mm.
situated right in your brain and readily available. But with all the traumas that we have and the adults have as well, in our society, it gets lost. And by the time we have teenagers in there, they're not being able to uh, really navigate life. They might find themselves in emergency rooms and not know
Yeah.
what to do with mental health issues. And so it's best to start right from the beginning and to learn. And it's never too late, because you can change. And parental um, advice and support is very important, because you can even affect the epigenetic changes that are happening and reverse it. And that's what scientists are saying today. So it's never too late, and it's always a good place to start, and it's now.
Mm,
So that's why I'm doing this work.
yes.
Hmm.
The way you talk about mental health and how it has been, let's say, has been dealt with, has been so many psychiatrists, institutions, the way they have been dealing with mental health is just so halfway. It's just seeing the human being almost as if we are just a bundle of parts, and then we just
Yes.
right,
Hmm.
not
Hmm.
addressing the whole person. And maybe that's why I keep bringing back spirituality, because it has been
Yes.
my big way into healing and wholeness.
Hmm.
So I guess that's another question that I have to ask you.
Well, that's okay, because the questions that you have could be the questions that other people have. So I'm very open to answering your questions, of course.
Thank you.
Mhm.
So what is when I know reading your book and your work, you do mention the spirit, body, mind, spirit, this holistic
Yes.
approach. So
Mhm.
what is the spiritual part of the human being? How do you connect that within your own life and your clients?
Well, I think I always understood spirit, even as a young child. I was raised a Catholic. I went to Catholic school. And I think that was the special aspects of my education from early on, that there was a God and that I had a guardian angel. And so
Yeah.
that's how I grew up in my home. and it was supported by through my education. We took religion classes every day, up and
Right.
through till the 12th grade in high school. So I learned about it, but as I grew older, I adapted it to my life. And as you were talking about, to nature and to what's going on in the world. It's like you could go to the church on the top of a mountain and
Yeah.
go to the mass there in your own mind. It didn't have to
Mm,
be in a
mm,
building. And
yeah.
so that was part of my life, and to communicate with the spirit world that I now call universe.com. I can tune into it. And so to know about the saints, to know about um, spiritual beings, the archangels that
Yeah.
I feel have been in my life since early childhood. So that's how I know my world. And I know some other people don't see it that way, but I incorporated it into my life from a very young age. I went to first grade when I was 5 years old. So that's when I was indoctrinated into this idea that
Ah.
God's with you no matter
Mm,
where you go. And I used to think it when I was a small child, I would sit in the back of the Catholic church under the choir loft because that's where they put the first graders. And I wouldn't know that there was anything in the church. All these taller people were sitting in front of me,
mhm.
and the eighth graders were in the first row, and I was in the last row of the church. And I remember just listening to the priest and these great stories. I didn't know they were Bible stories. I just thought they were stories about Jesus and the loaves and the fishes and all this.
Yeah.
And once the priest said that God is light, and since I couldn't see anything, I used to pray to the chandelier that was hanging above me because I thought God was in the light.
Yeah. That is really cute. And how do kids, teenagers, and children these days, how do they see this concept, this idea of spirituality or what the spirit is?
When I work with teenagers, say for a sport, I always incorporate it, like for the sport of wrestling.
Yeah.
And I even teach the coaches this, that it's a holistic sport. It's not just a
Mm,
physical sport, like
mm,
any sport, actually, like football or soccer, because everybody knows the moves. Everybody knows how to initiate a takedown or to hit the ball on the baseball field.
right.
But what about the rest of the person? And even though you have skills like the physical skills, you could get injuries. But you
Yeah.
need to use the power of your mind with the mental rehearsal, seeing yourself, getting that takedown. And it's very important to use your mind. And that goes beyond the brain because the mind doesn't
Mm,
have a physiological position inside your skull,
yeah.
but
Yeah.
the mind is throughout the physical body. So that involves muscle memory. And when you have muscle memory, you'll know how to hit the ball when you have the bat in your hand.
Mm,
So I
yeah.
explain mind that way, but also spirit is not necessarily a religious connotation, although it can be. I work
Yeah.
with a lot of students from Catholic schools, but it's just the core of who you are. And I say it's something inside you. It's your ways of knowing and your
Yeah.
connection. And I bring in, say, for athletes, I might bring in their predecessors on the wrestling mat, in the baseball field, like Babe Ruth, and talk about that. That's the spirit of their predecessors,
Mm,
and they're the ones who built up the sport and are teaching you what to do. So it's very interesting. They understand it from that perspective, that it's the core of who they are. And so I point to the chest and say,
mm. Yeah.
this is
That's
who
right.
you are. And you have to really honor yourself from that perspective, like all your skills, even though you didn't win the wrestling tournament, you still have to honor you and
Mm,
treat those skills like they're pure gold for you and honor yourself. So that's
yes.
how I connect body, mind, and spirit without talking about anybody's religion.
Yes, yes. So I love the piece of the ancestors, the presence of those who have passed, who have done what they
Hmm.
did. That makes sense. That they would connect with that. Do they ask
Hmm.
questions when you kind of talk about
They
this?
do. They do. It's very interesting. There's this one skill that wrestlers these days talk about, and they attribute it to the Russians. They called it a Russian 2-on-1, and it's actually on my brochure from ancient Greece. I took a picture of it. It was it's on the side of a building,
Yeah.
in a artwork. So I took this picture and I showed them, and I say, "So what is this skill? What is this move here?" And they said, "Oh, that's a Russian 2-on-1." And they said, this is from ancient Greece. It's
Wow.
really Greek, and the Russians
Yeah.
are claiming it.
Wow.
Kind of like Ukraine, they're
Right.
claiming it,
Right.
and so they're surprised because they then realize this is from ancient Greece, and you went there
Yeah.
and you saw where the first Olympics was near the Temple of Apollo.
Mm. Wow. You see, they don't see that connection yet. It's wonderful to have mentors like you to
Hmm.
point that
Hmm.
out.
Hmm.
And so we will dive into the topic of today's conversation, which is the chapter 2 of your book,
Hmm.
Wrestling Through Adversity. And the
Hmm.
topic, it's titled Building Resilience Today for the Failures of Psychiatry's Past. So
Hmm.
that's the title. Do you connect resilience to courage, Christine?
Yes, of course. Well, you see, we all think of adversity as something negative,
Yeah.
and I think of it as a positive in the sense that it helps us to move forward. Now, we can learn how to wrestle through the adversity and come up knowing more about ourselves and becoming resilient.
Yeah.
But if we don't learn those skills, then what do we do when we have adversity? And that's when we see all the adverse childhood experiences pop up in the traumas of children. And that's when we say, oh, well, maybe we should have done something before they become teenagers and the shooting people at school
Yeah.
or at the Kansas City parade. But really, if you handle the adversity early on, we're all going to face it. Even if you went to school, this perfect school, and you had this perfect education at home, the first day of school, somebody bullies you. What do you do?
Yeah.
So you don't know until you know how to handle it.
Mm,
And
yeah.
and so that's the case. And so
Yeah.
sometimes as parents, we try to protect our children, and then they don't know how to handle things out in the world. So it's important to teach these skills and let them handle it under your supervision. And then as they grow, you keep on adding on experiences so that they know what to do and
Mm,
they know how to help themselves. Because, the parents aren't going to be there all the time to protect them.
yeah. So the chapter 2, the title is Cracks in the Institutional Wall. Before we even talk again about the speaking points, I would like you to talk to me for a moment about the backstory of the title. I know you have one.
Well, the idea is that I learn about mental institutions at a young age, a fairly young age. I was a teenager when I first started to handle situations like people dying, because I was a nursing
Yeah,
student at the age of 16. And so I was in situations where I didn't know what to say. Like one time, a woman died in the labor room when she was giving birth, and I
yeah,
witnessed it. And there's the father standing nearby. And so, what do you say? And at 17, I didn't know what to say. So I was always interested in finding out, well, what do I say in this situation or that? So that was therapeutic interpersonal communication that I was starting to learn. And I always wanted to know that. I kept on
yeah,
asking the instructors, so what do I say in this situation?
yeah,
So from early on, I had this understanding, and it changed my perspective, I think, from other people's at the same age, since I was a teenager. So I would understand that the person's telling me something, and I'd look underneath the surface to see, well, what are they really saying?
mm,
And I thought that everybody knew that. I didn't find out until I was in nursing school, and a professor called me in her office after class, and we had this assignment, and it was on psychiatric nursing. And she said, we have to go out and interview people, and we have to ask them questions and write it down and then figure out what they're saying. It was in a column form. So I did that, and I thought the assignment was relatively easy. And so I brought it back and handed it in, but she called me into her office, and I thought, oh, I got a bad grade on it or something.
Yeah.
But when she sat me down, the first question was, well, how do you know this stuff? How do you know what the person's
Mm.
really saying? And I said to the professor, well, don't you know? You're the professor. And she said, no, it's a gift, right? And it's
Ah,
hard to teach. So she wanted to know about it. And so I started to think, well, maybe there's something to this, but it was still part of me. And you don't know what other people are thinking. You just think everybody's like you when you're
mm,
growing up.
yeah.
So it started there. And my interest when I went to actually have an internship at a mental institution, when I really began to question the sanity of it all, especially
Mm,
the treatments that were going on at the end of the 20th century. And I would ask questions, and there were no answers. But the idea was that I witnessed something, and they were changing at the time in the mental institution. This was at Kings Park State Hospital on Long Island, and I would ask questions, and I said, well, what they presented, that everything was fine. And I'm saying, wait a minute here. From my perspective, it's not fine.
right.
The little children on the wards where they were being punished because their parents were having a divorce, and they were acting out and they were given drugs. Or when the young woman she had obsessive compulsive disorder. Um, I don't know if they called it that at that time, but at any rate, she was one of my patients, for the day.
Yeah.
And I witnessed her just with a mop cleaning the floors of the institution,
Oh,
of the hospital unit. And I noticed that she didn't wring out the mop. She didn't have fresh water. She was just wiping the floors, which is
yeah.
very much in the institutions. The patients did the work like that. They thought it was therapy. They thought that this was something that they can do. And so you can imagine somebody who is very meticulous about cleanliness
Yeah.
just taking the dirty mop and washing the floors as therapy. But at any rate, she was not very much older than I was at 18, and she had to
Mm.
be brought in for electroshock therapy. And it was eye-opening for me. I had to pretty much drag her there, and she was holding on to talk about the institutional walls. She was trying to claw at the
Yeah.
wall, and she was trying to take the keys that were wrapped around my waist so nobody could take them. But she was kind of dragging me, and I was dragging her, escorting. They told me to escort her. And then I witnessed what happened on the table with the shock pads and the
Yeah.
airway, and had to be with her during the procedure, and how she didn't want to go into the room, and she was screaming. And then afterwards she was just like a zombie like figure,
Mm.
not knowing anything, not seeing anything, as I bring her back to her room. And that was shocking to me,
Right.
back then. And the early practices, of course, were even worse when they first started this in the 1940s, because they didn't give them proper muscle relaxants. So there used to be a lot of broken bones along with it.
Wow.
So that was my introduction there, and when I was 18.
Wow.
And then also I had other experiences on the backboards talking to the patients, and they're telling me they'll never get out because they, even though they were there as teenagers, but they didn't learn what they needed to learn to go out into the world. And
Yeah.
that was really researched quite a bit back in the 1950s and 60s, to prove that they didn't learn anything. They became accustomed to staying in these mental institutions, which were huge, up to even 10,000 people, in these housed in these buildings. And so I learned about that, and I learned about this older person who hadn't talked for 5 years, and she was on one of the wards. And I chose to sit near her and talk to her. And she said some words to me. She said, "I wear glasses too." And those are the first words she had said, apparently, in 5 years. And I told the nurses on the floor that, and they didn't believe me. They said no.
Mm.
she never talks. She hasn't talked in
Uh,
5 years.
mm,
So that was sitting near her and following her around. But there were no programs for her, nothing to just sit there in this big room they called the day room. And that was it, you know, before it was like a prison for her in that sense. There was no
right.
activity.
Wow, Christine. You did write something, wow, quite powerful, which relates exactly to that. It's shocking to me to hear all that. I read that, of course, in the speaking points for today's
Mm-hmm.
conversation. And it still shocked me just to think that psychiatry used to treat mental patients in this way. But I heard it's still legal, though. Those electric shock treatments,
Yes,
you call
it
lobotomy,
is.
it's still legal, right, in this country?
Yes, they use it for they say retractable depression, and I'm sure it's improved, the techniques improved,
Yeah,
but it's still known that even though you're depressed, there are other methods that you could use other than that, but it does cause memory loss. It really
yeah,
literally fries the brain, and that's one way of describing it. No matter how gentle the technique is these days. So, and I know people who had electroshock therapy when they were teenagers, a particular relative, and
yeah,
she doesn't remember large chunks of her childhood. So it really, and especially for young people like teenagers, when their brains are developing, to
right.
have something like that to curtail the development. And so I particularly relate to that, and also my experience, which proved when I looked in the history books to say that some nurses were petrified trying to help these patients. They
Yeah,
called it Frankensteinish
wow.
techniques
Yeah,
because of how they had to hold the patient down with six nurses, just to get them to stay put on the table.
right,
And so I know this from history, and also reading a lot of doctoral dissertations when I was at Teachers College. They had the fourth floor, and a lot of nurses wrote about the situations in psychiatric nursing, but also in hospitals, and their experiences were similar.
right. I know that there's a name for it, isn't it? For vicarious trauma. When you don't know what to do, really, then it's actually becomes a
Exactly.
trauma for the
Hmm.
professional too.
Hmm.
Um, wow, Christine. So, I mean, you talked to me before about this and the guiding points. You mentioned that again about you say it is important to learn this, what has happened before in history,
Hmm.
psychiatry's history, because if we don't know our history, we are bound to repeat it. So, is this
Yes.
something that new psychiatrists are they aware of the history of their own field, or this would be new to
I
them?
think that these things are put in the past.
Uh,
It's like they don't want to remember the treatments and the beliefs that
yeah,
really back them up. It was pseudoscience, to say the least.
right.
Like in the Trenton State Hospital, there was a doctor there named Henry Cotton, and he believed in this idea of focal sepsis, which meant that inflammation or infection in the body caused mental illness.
Yeah,
And a lot of doctors went along with it, even though it wasn't scientific like we would say today.
right,
But psychiatrists wanted to be known as researchers, and they wanted to be known because they had the reputation in these mental institutions
right,
to know more about the cattle there, because they grew their own food, and they had their own farms, and they had their own gardens, and that's where the people from the institution would work. So they knew more about how many cattle they had than how many patients they had, and more about the care of the farm. So they wanted to really be known as real doctors, and not just people who were kind of doing custodial care because there weren't any treatments
right.
except hydrotherapy, or really more like torture than
Uh,
treatments. So so that's when they decided to have this research, and also the electroconvulsive therapy that we're talking about was cheap. Electricity was cheap. And so you could get the results right
Ah,
away. And
ah,
also you could affect all the patients on the ward because now they became docile and you could talk to them. And so that response was seen as, oh, this is really working, you know, to help these people. And that wasn't the case because, first of all, it didn't last very long if it was effective at all, but
right.
it could be used on a lot of people. So, so when they don't want to look back to this era, I call them the somatic treatments,
Yeah, yeah,
but they lasted a pretty long time. So with Henry Cotton, what he would do, and this is one lady that I mentioned in my book. Her name is Martha Hurwitz,
right.
and the great Andrew Scull, who's a social historian, talks about it in his books. And she was a woman who was told that she has a mental disorder,
Yeah,
and she was in the hospital in Trenton State for I think 54 years. And because of this focal sepsis, she had all her teeth pulled. That was one of the ways to treat mental illness. And
wow.
she had all these treatments in neuroleptics when they came about, and also malaria fever therapy. And just for like 54 years, they tortured this poor woman. And that she didn't die from mental illness. She died from a fractured hip and then pneumonia and big bed sores and the like. So I call her in my book the posthumous wrestling New Jersey wrestling champion after all the things
Yeah,
that she went through and wrestled
wow.
through
Yeah,
in her life. And so she was emblematic, I think, of a lot of people who were in that situation where they went into a mental institution and then you're not taught any skills. And besides that, the treatments were less than scientific. So that literally, like with insulin shock therapy, the idea was to make your brain anoxic, meaning it didn't have oxygen, up to hours.
wow.
And that was supposed to help you to forget your memories. Well, it also shrunk your brain, these treatments. And that's why psychiatrists are still called shrinks.
Ah, yes, right. You did mention that.
Mm-hmm,
I didn't know that.
mm-hmm,
I had no
mm-hmm,
idea. That's what the name came from.
mm-hmm.
God. And you did mention, I'm trying to find here about somatic treatments. So they used to, okay, all these treatments that they were more torture like, which
Mm-hmm.
very much sounds like. But today you did mention that the psychotropics, they're very similar, giving us the pills and the body, it's still numbing everything. So in a way, they just
Yes.
changed the way to do the same thing.
Yes. Well, in 1952, they had a drug produced, the first, they called them neuroleptics, and that was Thorazine. And it was produced in this country, in the US, by 1954. And there were lots of stories about distributing those, and the nurses would have them in their pockets and go around at night and give them out
Ah,
in the mental
yeah,
institution, on the rounds, because there were very few nurses with a large amount of patients in those days. So they talk about how that opened up dialogue, and there were some benefits to it, but they didn't disclose that it causes tardive dyskinesia, which people still have it. You see ads on TV, but now they have some drugs that you could take to alleviate it, although they could also cause more tardive dyskinesia. But they didn't expose that to the public. But what they did was it allowed people to talk and to open up. And so now a lot of the work of nurses was to be jailers, actually, to have the keys, and they weren't allowed to talk to patients. So now they had all this free time, and they started to introduce sociotherapy, where they had parties and games and things like that. And that was the
right.
nurse's responsibility, as well as begin to learn how to talk to people. And that was really a very important progress for nursing, because
Yeah,
there was a woman
yeah.
named Hildegard Peplau, and she's known as the psychiatric nurse of the 20th century now. But she wrote the first nursing theory, and it was based on her time in World War II. And she taught interpersonal relations, and she was the one who taught at Teachers College in 1952, and really reached out to the entire world. And she went
Wow.
to mental institutions every summer on her own as a volunteer,
Mm.
teaching nurses how to speak therapeutically to patients, showing them what to do and how to talk to them. And so she's the one who set the foundation for me that I use in my private practice, the
Yeah.
principles that she taught, um, how to speak to people as persons rather than as patients.
This is something that you talked about. Yes, yeah. So you wrote actually, it's titled seminal paper titled Therapeutic Interpersonal Interactions, the
Yes.
sacrificial lamb that you have
Mhm.
written and is being used
Yes.
today. So that's wonderful that there are people recognizing the problem and trying to do
Oh,
something about it.
yes.
There are many.
Recognize it. You see the basis of all this. So we asked today, so why are we crazy? Why did we do these treatments? And one
Yeah.
of the worst ones, of course, was lobotomy.
Yeah.
And that was horrific.
Ah,
And I remember seeing One Flew Over the Cuckoo's Nest, and maybe you saw that movie some time ago. It was in the 1970s, I think. Well, that was the reality. That's what happened. And when I was at Teachers College, I met a nurse who, in her earlier years, her husband was stationed in Williamsburg, Virginia, and she was an OR nurse. And I asked her, what was it like there? This was it must have been in the 1950s when she was
yeah.
there. And she told me that because she was in the OR, she was responsible to help the doctors the patients have lobotomies. And when I mentioned that word to her, she just broke down in tears. This is years
Mm,
later.
yeah.
And she said she felt so terrible that she had to assist. It was her job. She was a young nurse. And then what the patients looked like afterwards, because that procedure, of course, was really butchering, sticking an ice pick through the eye socket into your
Yes.
brain and then destroying part of your brain. And then
Mm,
you would be like hugging teddy bears afterwards and crying. And she
right.
said afterwards was the worst when you walked through the ward. So that was a personal communication with my friend, who was this great OR nurse, and later on was in charge of huge hospitals, ORs like Mount Sinai in New York. But she remembered that early experience, and she said she'll never forget it. And all the big
Yeah.
names came there, and they thought this was gave people hope. And even the Kennedys were affected by it, because we all know about Rosemary Kennedy and
Oh,
how at the time people were saying that she was retarded. Those were the words used. And her father was convinced by these doctors
oh
that, oh, she
no.
would be fine after having a lobotomy. And now she was this
Mm,
beautiful young woman. She had the most perfect smile, I know, because I have a book, a biography
yeah.
about her.
Yeah.
And so they did this to her. Of course, sometimes the patients didn't even have consents. It was sometimes family said, okay, do it, or no family. They just did it. Um, it's like if you watch the movie, you'll see how people were selected. If you were too rowdy, you might be selected, or if you were homosexual, or if you were a woman, you might be prone to
Uh,
having this. And so she had the procedure, and the very next moment, she couldn't function for the rest of her life. It just totally destroyed her personality, everything, and her ability to care for herself, and even toilet yourself or anything like
right.
this. It was just horrific. But now we look back and we say, oh, and the person who was the co-creator, Moniz, he won a Nobel Prize for this in 1949. So you could see how desperate we were to
Yeah.
to learn how to take care of people who had mental disorders. And it was all somatic, meaning a physical approach rather
Yeah.
than talking
Yeah.
to people. And and it was just horrifying to me, to see this. And it's reflected in the movies, like A Beautiful Mind, that was
Yeah.
about insulin um, therapy, coma therapy, and then One Flew Over the Cuckoo's Nest, and of course the early movies like Snake Pit and
Oh,
I Never Promised You a Rose Garden. Those movies
right.
enlightened me when I was younger. But I still have the film part of it, a video of the movies. So I do watch them as I do my research, part of my research.
Yeah. Wow, Christine, you've been doing an amazing job bringing
Thank you.
all these back as a historian because we need, and that's so true, we need to see what has happened, how it has
Hmm.
been, and if it has
Hmm.
worked. Because if it has not, so we need to change the approach. That's common
Exactly.
sense, isn't it?
Exactly. And there's always been this issue about what is mental illness.
Yeah.
and
Yeah.
and so we don't know what it is, but we have this book. It's called the Diagnostic Statistical Manual of Mental Disorders, and everybody uses those books, the
Right.
psychologists, psychiatrists, the social workers. And there's a controversy with that because I also studied the creation of that manual
Mm,
in
wow.
my research. And that is part of it, is so that these people, these healthcare professionals, are paid, because you can put the diagnosis down. And so
Ah,
it's a checklist of symptoms and signs and syndromes. And if you have it for long enough, if you have it for 6 months, then you have
I
it,
see. Yeah.
and it can be, you can bill it. And so that's part of it. But it was also created for research. So everybody's on the same page to start the research in psychology. And then the other reason was that when say psychiatrists went to court, they one person would have one diagnosis and one with another. It wasn't really defined. So those are
Right.
the three big reasons why that manual was created in 1952, which is the very first one.
Right. So it's really based on technicalities, and you also insurance purposes, payments, money, right? So that
Hmm.
has to do with
That was
that.
part of it. And now looking at it, and even in foreign countries, they're looking at it and saying, what? you know,
Yeah.
just based on those principles. I mean, we're still using that today. Um, and other
Yeah.
countries are starting to change the way they look at it. It's like
Yeah.
schizophrenia is more on a spectrum. And it's interesting to note that some of the cases of schizophrenia said they have hallucinations, and that makes you crazy. But the research is finding out that people who don't have schizophrenia have more hallucinations. It's just
Uh,
that they don't affect their lives as much.
yeah.
So that's on the spectrum, and it also eases the the stigma associated with it, if we think of it that way.
Right. Which helps. I interview a lot of people on the mental health field, as you know, and I see a lot of psychologists. They are turning into coaches for that reason. They don't want to diagnose anymore, according to that book. So they are becoming a lot more, not just holistic, but they are focusing on spirituality, some of them even more.
Hmm.
Like you just said something that I would love to ask you the question: what is mental illnesses? Like, what is the calling? What do you see that being the calling? Because there's always something behind everything. I love the idea that we can go deeper instead of
Hmm.
stigmatizing or judging.
Hmm.
So, how do you see that personally and professionally, you, Christine?
Well, I think these days, and to avoid stigmatization, we call everything mental health. Like, we have mental health issues. And, the people who go in and shoot up the whole community, they have
Yeah,
mental health issues. But there are some people who say we shouldn't call that mental health. We should call that mental disorder,
yeah,
because of their behavior and how they're not fitting into society, into the norms of society. Obviously, if you're shooting up children at the Super Bowl parade like that.
right.
But I believe is, can you function, and how can you function, and how can you fit yourself into society, um, as you are? Okay,
Yeah,
there are reasons why children develop hallucinations early in childhood, and there's some thought about that. But there was this great doctor, Dr. Greenspan, who wrote a book about the growth of the mind. And he said that no matter what the situation is, you can work with these children. They can grow up to be leaders, no matter what they have on the autistic spectrum,
yeah,
or it doesn't
yeah,
matter. These children can be leaders and productive people. And so
yeah,
that's how he worked with it. So you can take the case of ADHD. That's a prime challenge, right?
yeah,
So you can label a child at a very early age, even as young as 2 or 3, because they're not fitting in to the nursery school, scene. I know I had that challenge with my son when he was a 3-year-old, and he was very active when he was born, just like I was. I
Yeah.
describe it in my book how I climbed telephone poles when I was 3, and I taught myself how to roller skate when I was 3, and I just said to my sister, "Put these skates on me and show me what to do." And then
Yeah.
I took off on this little
Yeah.
skating race on a block, and so I was very active. So I knew myself, and at an early age, I was told that I had ants in my pants and that there's something
Ah.
wrong with me. But I managed to use this wonderful energy. I see it as a natural resource, but it depends on how society looks at it and
Yeah.
what we can do. So I'm just using this as an example. So instead of teaching the children how to manage their high energy, as I look at it as a natural resource, some
Yeah.
people think, well, they don't fit into the classroom. Like, what's wrong with them? So I brought my son to this nursery school. I think he was 2.5. It was just like a 2-hour thing in the morning. And the teacher was so organized in her little classroom. And she said at the end of this interview, it's like, this is an audition for my son to go there.
Yeah. Yeah.
And she said, "Oh, look, he took all these toys out and he didn't put them away." And I said, "Yeah." And he
Right.
was playing with them. And
Yeah.
she said, "Oh, and when I called him, he didn't come right to me." And she said, "I don't think he's going to fit in our classroom. There's something wrong with him, and he'll just come here, and he'll have to
Mm.
prove himself. And he should just play with Fisher Price toys." This is what she told me. And so when I left there, I think I cried for 3 days because my son was my first child.
Yeah.
And I just cried and say, "What? Fisher Price?" Which, no insult to the company, but she said he should just play with toys and play, these friends who play with toys. So anyway, I brought him to another nursery school that was much more enlightened. It
Yeah.
was called the Green Twig, and it related to how a tree grows, how children grow.
Mm.
And so they said, "Oh, look how alert he is. Look how he's doing this. Look how he's doing that." And I said, "Oh, thank God." So that's where he went to nursery school, and he excelled there, um, because of his high energy and his
Ah.
memory and his observation skills. Like one time the teachers couldn't find their scissors. So he's playing on the floor with his friend doing a project,
Yeah.
and he just pointed, "The scissors are over there." Yes, he was playing because he was so observant. So
Wow.
that's what I like to see, to nurture the child and not to label them. And then worse than that, to give them the psychotropic drugs that are addictive.
Yeah.
And that's where we come back to the what we're doing today. As I said in the chapter, there's some people call it the lobotomization, which is chemical now, of our brains from so many toxic drugs that we're taking, and in combination, because you can open up your medicine cabinet and have so many, and they counteract each other. And some people use them to commit suicide, and it
Uh,
makes you crazy.
yeah.
And so there's the same degeneration in the brain, and it's not very helpful. And that's what we depend on in this country rather than talking to people. And so that's why I say we need to take this into our own hands and
Yes.
learn what to do and
Yeah.
rid ourselves of our traumas from early childhood, which I speak about in the book, and then reach out to our children and teach them the same skills that the Kansas City Chiefs used to win the Super Bowl.
I
That's
know.
mental rehearsal,
Yeah.
relaxation, breathing easy, all the things that I teach in my book and with my clients.
Yes. 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 A billion times. And thank you again for this initiative. Yes, I love the what you just said. There's a beautiful suggestion to not label, but
Mm.
to guide and redirect energies, because that's basically what it is, right? Energy trying to
Yes,
go somewhere.
exactly. And just think, if our children don't have energy, oh
Yeah,
my
right.
goodness. If you ever walked into a nursing home,
Yeah.
people are grabbing you and trying to touch you, talk to you.
Mm.
I was recently in one, and I had this experience right at the front door where this lady was in a wheelchair and coming towards me. Get me out of here! I'll pay you $1,000.
Oh my
Yeah,
God.
and and I felt so sorry for
Yeah.
her. But they're grabbing, and they wish they had the energy they had in their youth. And so, why would we suppress it?
Mm.
Why would we make it so everybody's the same? No one is the same. We're all having challenges. We're born with we're born in our birthday suit, which is naked, right?
Yes.
And
Mm.
we have to learn how to fit ourselves into the world. That's everybody who's born. And sometimes we don't even have the organs on the same side of our body. We have them like
Yes.
the liver's on the left side rather than the right side. And sometimes all our organs are reversed, so we're not the same physically,
Mm.
mentally, spiritually, any which way. And so to think that we are and to say there's something wrong with you. And I remember, thank goodness, my
Mm.
parents said about the ants in the pants that this is normal, a spirited child, and
Yeah.
they love that part of me, and they let me be independent like that.
Yes.
So I look
Yes.
back and I thank them, you know, for
Yeah.
raising me that way.
So we're almost at the end, Christine. I wanna see here if there's anything else that I missed. Probably, as I mentioned to you off record, that there's something about me about being linear that just doesn't. I'm all over the place.
You are linear. No, you have your pace. You
Yes.
have your pace. You're pacing and leading. That's important for communication.
Yeah, so thank you for allowing that flow, and I'm really grateful to do what I do because most of my guests, all of them, let's just flow, let's just dance with this, whatever this topic
Yes.
that we have at hand. So yeah, I love your message about becoming more open to the expressions of being a human, what is to be a human being. So it seems like we have
Mhm.
created a lot of models, fixed models with society structures, and we are
Mhm.
trying to fit humans into those models as trying to fit them as like robots, and it doesn't
Mhm.
it doesn't work. We are creating
Mhm.
more problems, and
Yes.
that's the way to go. And I'm so glad that you found a school with this kind of open mentality for your child. I hope it's getting better these days with schools, public
Mhm.
and private. I don't know. I don't have children, so I have no idea. Do you
Mhm.
think it's getting better too?
Well, I think there's interest, but however, I don't think there's enough guidance for
Mm,
parents, and
yeah,
I don't because in this world they don't know what to do, especially in schools when we have the school shootings. They
yeah.
just
Mm,
don't know what to do. And matter of fact, just recently I was asked to give another talk about the Kansas City chief shooting from the perspective of how to help the teens. And I was also called in October to do the same on a TV news station for the Maine shooting. So we still
yeah,
have these challenges, and we're not moving any place to help children, teens, and young adults to move into this new world that they've only known, say, young adults up to 25 or 24, they've only known terrorism and shooting and killing, and they don't know anything else.
yeah.
So when you think about it, we haven't solved the issues at all, and we need to really focus on the Gen Zs so that they can use their thinking, their ways of knowing in the 21st century and guide them from what we do know so that they can be productive citizens and know what to do,
Right.
and not just be pie in the sky. I think we'll have
Mm,
like a 4-day work week and we'll do this and we'll do that, but to fit themselves into the new world because they are the leaders of the future. And I really totally support them. I love working with young adults for that reason.
yes, that's really wonderful news to have more people like you doing this work. I'm wondering if you have thought about the programs, the coaching that you have already in place, mindful toughness, skill sets for children, teenagers, and young adults. Are you kind of pitching in a way schools, high schools?
Well, I have taught. I have given workshops and presentations, mostly related to sports, because
Yeah,
that's where the most open. So I
yeah,
have taught the mindful toughness skill sets not only to student athletes, but to coaches. And some of the students I work with, because I've been working so long, for nearly 28 years, so some of the
Yeah.
wrestlers I work with them when they were 9 and 10 and teenagers, they're now grown up and they're coaches, and they're teaching their students the same, same
Yeah.
techniques and what to do to help them to win, so that their students become champions. And it's not just about winning championships, it's about having these skill sets so that you can navigate, because these are portable skills.
Right.
So I always teach from the perspective of, well, what do you like to do? Are you an athlete? Are you a musician? Do you have hobbies? Oh, I like to game. Okay, so we'll use these skill sets to help you with gaming, and then you apply it to school to get better grades, and then you apply it in social situations. You want to
Right.
get a date for the prom. I've worked with wrestlers that way. They say, "Oh, I want to win. I want to win the championship, but I want to get a date with this girl I like."
Yeah.
So I help them get the date, and then also to talk about what they're going to say once they're at prom. What
Yeah.
will they say for a conversation? And so they love that they're portable.
Ah, that's wonderful too. Expanding through other areas of their lives, just applying everywhere. So
Yes.
I love how practical it is. So we're almost at the end of our lovely conversation. Thank you so much again, Christine, for doing what you do.
Oh, you're welcome. And it was great speaking with you, because I want to spread the news. And it also is so important to realize that as parents, as teachers, as coaches, that we have to really know ourselves so that we can help our children to move
Mm,
forward and not depend on the mental institutions or the drugs, and say,
right.
here, these are simple techniques. I teach mindful toughness techniques like breathing.
Yeah.
It's free as the air you breathe. Once you learn these techniques, you use them. And I know, because some of my clients come back after years of working with me and say, "Oh,
Yeah.
now I just graduated from college. Let's apply this to my new job," like that.
Yeah.
And so it's really beautiful.
Hmm.
Hmm.
Yes, yes, yes. Yeah, a billion yes to that. Thank you again. So before we say goodbye, I want to mention your website, idealperformance.net. So that'll be at
Yes,
the end of this podcast interview. Also, the book linked to Amazon, Wrestling Through Adversity, Empowering Children, Teens, and Young Adults to Win in Life. And before we
yes.
say goodbye, I would love for you to read a passage in your book, Christine.
Oh, sure. I have something prepared that relates to our conversation for sure.
Yes.
And it's actually in chapter 1.
Ah, okay.
And the title is Society's Mandate is to Fight Back as Independent Practitioners. During these times of chaos, there is a call to action for everyday people to learn what it takes to make lemonade out of lemons and win, simply because our government and mental health care system is broken and is not
Mm,
equipped to handle the mental health challenges we face, with
yeah.
shortages of personnel and resources, which, as history repeats itself, will only end in further disaster.
Mm,
We have been lied to by psychiatry in the past about scientific treatments. We have been given false hope for cures. As citizens, we have been tortured, stigmatized, and laughed at in derision, especially those with serious mental disorders. As if this is not enough, U.S. psychiatry has an outdated view of what comprises mental health and mental
mm,
illness, with no conclusive definition of either one. To accomplish this imperative, it is incumbent upon all of us, particularly for adults who serve as role models for young people, to learn about ourselves, to uncover mental blocks and ACEs, adverse childhood experiences from childhood, that hold us back, to study child rearing practices from experts in the field, and to help our youths, teens, and young adults grow and build resilience to handle life's challenges they will face. This is necessary because we cannot allow others to take control of our mental
mm,
health, as in the past in psychiatric institutions, when we have innate abilities and power within our own minds from our Creator that are as free as the air we breathe and are
mm.
as easy to learn and use by kindergarteners through the use of my innovative programs I present to you in this book.
Yes, yes. Wow, how How amazing you are. I love how you write. I love how you express yourself. I love what your heart's doing. So there's a lot of compassion here. I see too. Thank you so
Thank
much
you.
again, Christine, for being you, for doing this.
Yes, thank
And
you.
we'll be
Thank
in
you,
touch
Valeria.
again. Thank
And
you.
I'll be happy to be in touch again. Goodbye
Yes,
now.
yes. Bye for now.